So the COVID-19 is spreading like disease from the whole world thing from the China, but I think COVID-19 in the future 2020 is for real, but it's virus spreading is what the demon from underground. And I'm gonna show you one. I'm gonna show you from the COVID-19 spreading disease on the news report. But
we are closing out a week that has seen more new COVID cases in America than in any week since the pandemic began. And Americans are becoming more worried. Our new ABC News poll with Ipsos finds more than 3 in 4 Americans are concerned about contracting the virus, the highest levels in a month. And for the first time in nearly 2 months, the White House task force will brief the nation, and that will be this afternoon.
And new cases hitting a record for the second straight day. Listen to this, 39,000 new infections. And take a look at this map. All 15 of those states have now hit daily records within just the past week.
Texas is one of those states, and Marcus Moore starts us off in Dallas, where the governor has put the reopening of the state on hold and is taking steps to free up hospital beds for an influx of COVID patients. Good morning, Marcus.
Michael, good morning. Here in Texas, there has been a strong push to reopen fully, and things seem to be headed in that direction. But now, officials here with the rise in cases have pulled back on things like elective surgeries in several counties across the state. Doctors are sounding the alarm this morning as California, Florida, and Texas, America's 3 most populated states, hit new record highs in daily COVID cases and hospitalizations. Now, the White House task force back in action, preparing to brief the country this afternoon for the first time in nearly 2 months. As the U.S. marks a record high for reported cases since the pandemic began, more than 39,000 new cases in a single day. The CDC issuing this grave warning about the number of infections.
Our best estimate right now is that for every case that was reported, there actually were 10 other infections.
This as ICU wards fill to capacity. According to a FEMA update obtained by ABC News, in Alabama, some hospitals now transferring patients from facility to facility as they run out of ICU beds. And a dire situation unfolding in Houston, the country's 4th largest city.
We are definitely feeling the surge in Houston. More hospitalizations, more ICU patients. So number one, it's real. It's out there. It's not just numbers reflected in testing. More people are getting sick.
At Texas Medical Center, they're moving into surge planning as ICU beds fill rapidly. Doctors say by early next week at this one facility, there could be 60 ICU patients here, with that number rising to 80 by the end of the week. Now, as the number of COVID hospitalizations in Texas reach record highs for 13 of the last 14 days, Governor Greg Abbott hitting pause on the state's reopening. Across the country, cases are rising in 29 states, including Florida, where new cases have now topped 5,000 2 days in a row.
We are in a worse situation than we were at the beginning of the pandemic. Absolutely. Our rates of infection, our rates of new cases, the types of people who are getting infected are all increasing.
Governor Ron DeSantis under fire for not making masks mandatory across the state. And in Arizona, the governor halting the reopening process as well, with more doctors and nurses being called in as hospitalizations increase. Bridget Harrigan is a traveling nurse. She spent a month treating patients in hard-hit Queens, New York. Now she's on the front line in Arizona.
It's a very difficult time in the hospital right now. Obviously, for patients, they're talking to me and they're talking to me about their fears and they're really terrified. So it helps to have people here to comfort them.
The CDC also says there could be a 3 to 4 week lag between new cases, hospitalizations, and deaths, which leads the CDC to a sobering forecast that, according to their models, if states cannot stop the spread, the death toll could reach 150,000 by July 18th. Cecilia.
Sobering indeed. Okay, Marcus Moore, thank you very much.
Good evening from New York. I'm Chris Hayes. In sheer numbers, the coronavirus outbreak is worse than it has ever been. Before this week, New York was the only state to ever report more than 5,000 new cases of coronavirus in a single day. But now, Texas, California, and Florida have all crossed that threshold on multiple days. Just today, Florida nearly doubled it, reporting almost 9,000 new cases. In total, we have set another single-day record in the U.S. for new cases, surpassing 40,000 for the first time.
This is happening COVID-19 spreading in New York and on the world, you know.
Our new infections per day not only dwarfs every other place on Earth, it shatters our own previous records for how quickly this thing can get worse. Remember, that's not cumulative cases. That's new cases each day. That's how much bigger it's getting each day. I mean, when New York was at the apex of destruction, there were 10,000 new cases in New York a day. That was the very peak. There were nearly 9,000 new cases today in Florida. That was the new record for them today. Nearly 6,000 new cases today in Texas. That was a record for them today, too. Arizona also hit a new record for new infections reported today. As did South Carolina. As did Tennessee. As did Idaho. As did Georgia. As did Utah. I mean, just for perspective on what's going on right now in the country, Maricopa County alone, where Phoenix is in Arizona, they're now seeing as many as 2,000 new cases a day, which the Washington Post notes today, quote, eclipses the boroughs of New York City even on their worst days, from what was previously the worst of the pandemic and what remains the worst any American can possibly imagine about how bad it can get. Maricopa County, more new cases per day than the worst of New York City in the worst of it.
I knew things were going to get bad. You asked me how soon. I thought it would probably be sometime in July, but I'm now confident that we'll be in crisis standards of care within the next few days, if not by the end of the weekend. I mean, it's gotten so bad so fast. And the reason is, because the public policy that we developed and that was used at the end of the stay-at-home order really set in an honor system. And an honor system isn't adequate to direct the kind of human behavior that we need to slow down the spread of this virus. And so that's really what happened. Is this is directly related to policy decisions that have been made. This is not bad luck. This isn't anything like that. These are directly related to policy decisions that happened in this state.
We are now suffering a surge of coronavirus cases in Republican-governed states. Florida is setting new records every day with the number of new cases. Today it was almost 9,000. 8,942 cases in Florida today. That's almost double the record that they set just 2 days ago. Today, Florida abruptly ordered a shutdown of bars. And in breaking news tonight, Miami-Dade County's Republican Mayor, Carlos Jimenez, will sign an emergency order tomorrow, closing all county beaches starting July 3rd and restricting any gatherings and parades of more than 50 people for the holiday weekend. The mayor is also requiring masks to be worn inside commercial establishments and outdoors when social distancing of at least 6 feet is not possible. The Republican governor of Texas is now reversing his reopening plan. Just yesterday, the Texas governor said, the last thing we want to do as a state is go backward and close down businesses. And today, the state went backward and closed down businesses. Governor Abbott issued an executive order today shutting down bars and reducing the number of people allowed in restaurants. The mayor of Austin, Texas, Steve Adler, says the governor has put the state in danger.
What we tend to do if there's a patient that needs any kind of care, whether it's COVID care or some other kind of higher level of care, and they don't have space for that at their particular hospital, they have to seek a transfer. And it requires another hospital have the capacity to be able to accept that patient. Otherwise, you can't transfer them. So in our case, if we're stuck in that situation, what we would have to do is continue to manage those patients in the emergency department on our own. And that's not something that we as emergency physicians necessarily want to do, because we're used to finding and diagnosing the problem and then getting the person to where they need to be. But unfortunately, we're put in a situation right now where we're having to function as either a hospitalist or as an internist or an intensivist if there's no space upstairs in the hospitals for us to care for our patients.
We've been on the front line, been pushed and pushed since all this started with our first peak of this first wave happening at the end of March and early April, and kind of being on guard and stressed, if you will, ever since we have a significant number of colleagues get sick, some unfortunately die, and as we all saw that happen in New York, that plays a significant toll. As healthcare providers, not just physicians, not just nurses, but I'm talking respiratory therapists, social workers, our unit coordinators, or even our environmental services. We're husbands and wives and parents, and we're humans, and we need to be able to take care of our families. And when our family members are getting sick, or when we're not feeling mentally and emotionally healthy, people are going to make a choice that they can't come to work, whether it be because they're getting physically ill, which some have, or because they're feeling stressed and don't have that emotional capacity to be working in their full scope of job.